The second point to be known as a Yemen, that's called as a EM2 point. Why EMEN, that Yemen to be considered as a EM2? Why AMEN, that Yemen to be considered as a DU15? DU15 also Yemen, and SJ2 also to be considered as a Yemen. Only the YEMEN, that's a YAMEN. Right, both are the different gates, but this gate is amazing. I love this, both the points. Really, this tremendous results you will get by activating these 2 points. But however, when I talk about the Thuma, that's called as a zero meridian, so that you will going to love that particular meridian. One particular point to understand, it makes me 2 decades. Remember, to understand one particular point, it takes me 2 decades to insight of that knowledge. I'm using that, but I can't get the proper results. Why is it so? Then I researched further that. So that research I am going to execute when I take the zero meridian. Right, now let me see the second point to be known as a MN. So this is MN is the amazing point. So where exactly this point is located? So midway between the 2 fingers. So one finger is the pinky finger, the second finger is the ring finger. So midway between these 2 fingers there is a web margin. This called as a web margins. This called as a web margins, right? So this web margin, there are the 2 authors or the few authors write in the different levels, but however, as per my perception, this point is located 0.5 chon. Proximal means above to the web margin. On the 2 words is the key to the ring finger, not on the pinky finger. Now just we apply this point is SJ2. Yeah. You just take the deep breath. You just take the deep breath. Good. Just take the deep breath. Good. Just take the further deep breath. Good. So these are the point which we call as a Yemen. Right? SJ2. So SJ2 is grandmother point, and also this is water point. This is water point. So where exactly you try to understand, this point is exactly located on the this point is located on the half chon above the web margin. Half chon above the web margin. You just see, this is the web margin, half chon above the web margin. When we enter this needle, it is recommended to take the little deep breath is required, little deep breath, and then deeply insert the needle. Right, so this we can consider this is as a triple warmer 2 point. This I told you as a tonification point. SJ2 and then SJ1 or EM1, EM2 having the opposite functions. There is no normal functions. There is a opposite function each other. So SJ2 is governing to the upper geo. SJ1 is regulating to the lower geo. That means upper geo, you understand, it is communicating to the diaphragm to the top of the head region. Diaphragm is which is separating to the chest cavity and then abdominal cavity. So therefore this one particular point is governing to the top of the head. It's regulating the blood flow to the above the neck region or above the diaphragm region. That means it is governing to the chest cavity. That means it is regulating to the cardiac system, circulatory system, and also the respiratory system. When the respiration is having the difficulties or the problems, that particular time where the physiological aspect to be known as there is the balancing or the exchanging the CO2 and then O2 to be taken place in the form of the respiration, that's called as a inhalation, exhalation. If there is a difficulty is there, that means is the upper jaw is not functioning precisely. Upper jaw is not only the breathing problem connected to the pulmonary system, it is also connected to the cardiac system as well. Both are regulated by activating this point. At the same time, you understand the upper jaw to be known as there are the glands. This I told you, EM1 is related to the adrenal gland. EM2 is communicating to the beautiful point to be known as a thyroid, parathyroid, and then thymus gland. These are the three glands are secreted and regulated by activating this triple warmer 2 meridian. One is the thyroid, and the second one is the parathyroid, and third one is the thymus gland. The thyroid and parathyroid, what we call as a thyroxine, triiodothyronine, tetraiodothyronine, or we call as the calcium absorption to be taken place, the calcium secretion and then absorption to be taken place by the parathyroid gland. So whenever there is the patient is complaining about the thyroid gland disorder, then you understand the endocrinologist normally they prescribe the calcium medication as well. Where the parathyroid glands are not functioning precisely, that particular time they will give the supplementary medicine to the calcium as well to the patient. So that particular time it is recommended to use that. So by using the triple warmer, we called as a SJ2, this would be better point to regulate for the thyroid and then parathyroid glands. The thymus gland also essential. The thymus gland which is essential till the puberty, right? Which is located superior part of the sternum. Behind the sternum there is the thymus gland is there. That gland is really essential for the growth and development. When the children having the mentally retarded children or the growth children are delay milestone children or the Down syndromes or the cerebral palsy condition, that particular time the thymus gland to be secreted precisely. Use the local point and use some of the distal point for that particular gland. That also recommended to activate. Whenever the child comes to you when the delayed milestone or anything connected to that, or the spine is not functioning properly, the brain growth is not good, or there is the called as a overgrowth of the brain, there is the accumulation of the water inside the brain system called as a CSF is accumulated in the ventricles of the brain, that called as a that's called as a encephalopathy or the enlargement of the brain. That condition, all the brain related condition, because this is communicating to the upper jaw. So upper jaw is regulated by activating one point, that to be known as a MN. So therefore this SJ2, as I told you, this is the water point as well. When the water point is there, that means this is triple warmer 2 is communicating to the water meridian of the Fu viscera, that to be known as a urinary bladder meridian. So SJ2 is equal to the Kunlun, that is the UB60 point. So UB60 SJ2 is both the combinations are same. If we wanted to use it, what are the appropriate timings to use this particular point? When we wanted to try to understand about the organ clock theory, 10 p.m. is the more timing. The excessive timing energy is accumulated in the triple warmer. Then the 10 p.m. having the energy, but we wanted to give the energy to the triple warmer, that time it is required to 10 a.m. is recommended, not the p.m. When we wanted to take the energy, the more energy, that time you take the energy. When the energy is required to that particular organ, the opposite time, 10 p.m. having the more energy, but 10 a.m. having the less energy in this meridian, that time it is recommended to give the energy to that particular time. That's called as a 10 a.m. Yemen point SJ2 is recommended. If it is not possible in the 10 a.m., then which is the equivalent time to be known as a Kunlun, then what are the UB timings of the organ clock timings? That is, which timing? UB 2, 3 to 5. 4 o'clock is the peak timings. Then you just apply in the 4. In the 4 p.m. is recommended. So 4 p.m. or the 10 a.m. is recommended precisely by activating this particular point. So hopefully the people who are suffering for the thyroid related disorders, hypothyroid, not the hyperthyroid. Hyperthyroid to be treatable by activating, there is the one specific point, Qianxi, that is the pericardium 5. When the hypothyroid is there, that particular time is normally recommended to use. This point is recommended for the hypothyroid, where the thyroid stimulating hormone having the greater than 8. Normal level, it says 4.4 is normal, but up to 7 and then 8 to be considered as a normal, but greater than 8 is there, THS level, that time you can activate this point. However, greater than 5 also is there, it is recommended to use this point. Right, if it goes to the 50, 100, 150, 200 THS level, that time also it is recommended to use this point. But at the same time, it's not only one point to be recommended. Of course, as an integrated approach, then I come to the modern medicine here. There is the TCM says this point is good, but the modern acupuncture says this good for the thyroid. But the TCM doesn't say this good for the thyroid, but the modern medicine called as a allopathy acupuncture says this is the good. When we look into the modern medicine aspect as well, then it is recommended to use the point is known as a, you wanted to know? You are really curious? Say yes loudly. Yes. In the Zoom, I wanted to know whether are you sleeping really?
Yes,
right?
yes, no, sir.
That's a great.
No, sir.
ಮತ್ತೆ ಏನು ಹೇಳಬೇಕು?
ಪಾಯಿಂಟ್ ಹೆಸರು ಹೇಳಿ ಸರ್.
ಅದೇ ಮರ್ತೋಗ್ಬಿಟ್ಟೆ ನಾನು.
ಅದಕ್ಕೆ ಯಾವ ಪಾಯಿಂಟ್ ಇದೆ ಹೇಳಿ ಸರ್, ಮರೀದಿರಾ ಇರೋದಕ್ಕೆ.
ನಿಮ್ಮ ತಲೆಯಲ್ಲಿ ಲವ್ ಶೂ ಯು ಫೈಂಡ್ ಔಟ್ ಅಂಡ್ ದೆನ್ ಟೆಲ್ ಮೀ.
Okay, sir.
Which point? Before completion of this class, you should tell me. I think before that I could have tell the answer. Right. C12, C12, C4, C12, 3, 4. These are the points are governing to the thyroid muscles as well, thyroid glands as well. C12, C4. On the cervical region, right? This is in fact also recommended to regulate the thyroid gland. So however, the SJ2 is the more predominantly good point to treat for the, especially for the thyroid, right?